NBC News has learned that the FDA plans to present data at a vaccine advisory committee meeting next week, claiming that there's a link between the COVID vaccine and the deaths of 25 children. Joining me now is Dr. Vin Gupta, MSNBC medical contributor and global health policy expert. So this claim centers on data from a vaccine reporting system. Two experts have told NBC News that this is being misused. Break down what we know.
Yeah, Chris, for all your viewers, the Vaccine Adverse Events Reporting System, VAERS for short, exists for a reason, because we want to know in medicine, we want our patients to know that there's a way to report if something is happening that we weren't expecting to happen. So if there's an adverse event from a vaccine, once somebody goes home, this is a way for caregivers, for the patient themselves that received the vaccine, or for their medical provider to say, you know, something here is amiss. We want to make sure we report it. That does then not mean that you can just look at specific individual reports and draw causation, say, oh gosh, this patient is reporting fevers or chills or some other sort of adverse event, and then directly relate that to, say, administration of a vaccine, because there's a lot of things that can cause people to feel sick, one of which could be potentially mild side effects from a vaccine. So it's all to say that cherry picking data, Chris, from this database, you can't do that. You have to do rigorous controlled studies. You have to look at this data with a grain of salt, and you have to be able to analyze it in proper ways, which, by the way, has already been done. That's the issue here. That's what these former FDA officials who've looked at this data painstakingly for 5+ years since we've really been having these COVID shots, they've been looking at this. None of this is new. It's just because of the new leadership in town, it's being relitigated, but in not in proper ways.
So there is a headline in the story, and they go into some detail about it, about the alarm that's going through the scientific community about this. What's the concern about the impact?
Well, the concern is, let's take a concrete example. The FDA commissioner, all of this rolls up effectively to the FDA commissioner, and that is Marty Makary, former clinician that I deeply respected when he was caring for patients. But Makary did something in the early part of the pandemic. He linked COVID shots, especially in kids, to the risk of myocarditis. And what do we know? We know, Chris, that there is a small risk of myocarditis, inflammation of the heart muscle, if you get the COVID shot and you're younger. We also know that the risk of the virus causing that exact same presentation, myocarditis, is a lot higher. So the virus poses a lot more risk to the heart muscle than the vaccine itself for young people. What are they going to do? The fear here is they're going to distort the data, again, cherry pick data from this adverse events reporting system, not do it thoroughly or properly, and then misinform the public. For everybody out there, to be really clear, you can Google JAMA, J-A-M-A, pediatrics. There's a large study that was done in 2023, Chris, looked at millions and millions of kids that received the COVID shot between 5 and 11 years of age. What did we find out about these shots? They reduced hospitalizations, they reduced infections, frankly, and there was no incidence of severe adverse events. This has been already studied.
So we know that in August, the FDA approved the latest coronavirus vaccines, but in a limited way, right? You have to be over 65. You have to have an underlying conditions. We have been hearing reports about people unable to get the shot, people who show up who can't afford it. They have to pay a couple $100. Some people say more for the shot. I wonder what you're hearing in your community and the concerns you may have about accessibility, and if a lot of people don't get it, either for access reasons or financial reasons.
Absolutely. You know what we're seeing, Chris, most Americans get their COVID shot, their flu shot at retail pharmacies across the country. What are we seeing? Because of the confusion from the CDC, FDA on who can and cannot get this, 16 states, CVS and Walgreens just said this, 16 states basically in where they operate, they are not distributing the COVID shot because of this confusion, chaos at the federal level. That is impacting what everyday families can and cannot get from their pharmacist at the pharmacy down the street. That's having serious impacts on access. Let's be clear. Why does this matter? Because the federal guidelines, let's just take the updated COVID guidelines from the FDA, who can and cannot get it. Makes no sense that they're saying that pregnant women cannot get the COVID vaccine. It's important for pregnant women to get the COVID vaccine. The federal government is saying, no, that's not actually a high-risk group. The American College of Obstetricians and Gynecologists, Chris, said, no, you're wrong. We don't worry about pregnant women because pregnant women, their immune systems are protecting mom, they're protecting baby. And we note that there can still be severe impacts to both mom and baby if they get exposed to COVID, even 5 years in. What about 6 months to 23 months of age kids that don't have an underlying condition? Chris, we also know, and this is from the American Academy of Pediatrics, that kids 6 months to 23 months of age, even if they're otherwise healthy, they get exposed to COVID, still are at risk for ending up in the hospital. That's not a recommended group. Doesn't make any sense.
Dr. Vin Gupta, it is always good to see you. I hope you have a good weekend ahead. Thank you for coming on the show.